Hi, welcome everyone. My name is Lisa Burton. I'm with New Rochelle Against Racism, also known as NUROR. And we are here to talk about environmental racism and more broadly, or more specifically, the impact on healthcare. The reason we're here tonight is because this year, despite our city council declaring New Rochelle to be in a climate crisis, and one of the communities that is concerned about that, we had a proposal to have a drive-through Starbucks on Huguenot and Echo, 10 feet from emergency family shelter and about 25 feet from playground for low-income housing, and where seniors normally have picnics in the summer. So we are here to really kind of start having a conversation. This is number 3 in the learning module regarding environmental racism in New Rochelle. This Saturday, we're going to be having an environmental racist trolley tour, which is sold out, but we hope to be able to share more information about that. So tonight we have a panel of terrific people and in the medical and healthcare profession who will be speaking to you on this topic. So our host for this evening is Bruce Soloway, Dr. Bruce Soloway. So Bruce, take it away. Gotta unmute. Bruce, you gotta unmute.
Sorry about that. So good evening, everybody, and thanks for joining us. My name is Bruce Soloway. I'm a family physician. I have 35 years of experience providing primary care for individuals and families in the Bronx. And I spent 20 years in various leadership roles in family medicine departments at Bronx Lebanon Hospital, Montefiore, and the Albert Einstein College of Medicine. And I will serve as your host for the first part of this, and the Q&A later on will be facilitated by Dr. Steve Itzkowitz. Dr. Itzkowitz is a professor of medicine and director of the fellowship program in gastroenterology at the Icahn School of Medicine at Mount Sinai in New York City. He's done many, many years of research on access to colonoscopy among Black and Latinx residents of East Harlem, and he's found and proven that with equal access and educational efforts, screening colonoscopy rates among all ethnic groups in New York City could equal those of the white population. So I'm happy to have Dr. Itzkowitz with us. Next panelist is Dr. Dan Miller, another family doctor. He's been in leadership positions with Sun River Health, which is a large community health center network in the Hudson Valley, Long Island, and New York City. He's also been in leadership roles in the National Association of Community Health Centers, and he has spoken virtually and in person around the country on the effects of institutional racism and poverty on public health. Both Dr. Itzkowitz and Dr. Miller are longstanding members of New Rochelle Against Racism, or NUROR, and their comments tonight are their own views and not those of the organizations they work with. Dr. Angela Campbell has more than 25 years of management experience in various administrative roles in healthcare and education. She currently serves as the executive director of the Children's Health and Research Foundation and executive director of the Lower Hudson Valley Perinatal Network. Her team identifies women who are at risk for delayed prenatal care and poor birth outcomes and connects these women with the services and resources they need to get early prenatal care and to decrease preterm and low birth weight births. Her team also works supporting breastfeeding and preventing teen pregnancy. Dr. Marianne Mackman is a psychiatrist who spent 40 years in private clinical practice in our area before retiring, and she also served as a clinical assistant professor of psychiatry at the Albert Einstein College of Medicine. She's also a member of NUROR. So I want to just spend a couple of minutes reviewing just some basic concepts. And I really want to refer to a wonderful article that appeared in the New England Journal just a couple of weeks ago, called Environmental Racism and Climate Change Misdiagnoses. And we will make this paper and others available to all of you who are interested. It's not a highly technical paper, but it's highly impactful, I think. And it's written by an emergency room physician who tells the story of treating a young girl for asthma, who kept coming back to the emergency room over and over again, despite all the efforts of her doctors to get her asthma under control. And her distressed mother says, "I've done everything the doctors have asked, and she just keeps getting worse. What am I missing?" And the doctor, after doing a little extra work, discovered that it wasn't the mother who was missing anything, that the doctor herself felt that she had missed a diagnosis. And the diagnosis that she had missed was environmental racism. And she goes on to define environmental racism as a type of structural racism, including the use of racist practices in determining which communities receive health protective infrastructure like green space and which receive health harming infrastructure like highways and industrial complexes, and we might add drive-through Starbucks. She goes on to review evidence more than a decade old from the American Heart Association, showing a causal relationship between air pollution and cardiovascular disease and death. More recent evidence from the American Thoracic Society that long-term air pollution exposure causes childhood asthma. And also evidence just from a few months ago that regardless of geography and income, people of color are more likely to be disproportionately exposed to air pollution from almost every source than white people. And so she concludes that no matter what this young child's mother or their doctors did, this young patient's physical environment would continue to make it nearly impossible to control her disease. And I want to just mention as well an old public health parable about townspeople at the bottom of a river who find children floating helplessly downstream and are working frantically to rescue them, pull them out of the river. And eventually some of the townspeople decide to go upstream and find out who's throwing children into the river. And this really goes to the issue of looking for underlying causes. And we really have, unfortunately, in New Rochelle, as well as many other areas, political leaders who are very nonchalantly throwing our children into the river. And we need to put a stop to this. We need to understand the relationship between environmental racism and public health. We need to undo the effects of environmentally racist development that's already taken place. And what we're trying to do here is to prevent environmentally racist development that's taking place right now and will take place in the future. And we hope that tonight's presentations will move us towards those goals. So with that introduction, let me just allow each of our speakers to spend a few minutes talking with you about issues that are on their plates as it comes to environmental racism. And we'll start with Dr. Dan Miller from Sun River Health.
Thank you, Bruce, and thank you, Lisa. Can you all hear me?
Mm-hmm.
Great. So let me just begin by just first appreciating the work of Lisa and New Roar in bringing this together. This feels like a really important conversation in our community now, and it took a lot of work to do this, and it's important work. I'm going to focus my comments following yours, Bruce, on the proposed Starbucks drive-through and use it as an example of some of the health effects of environmental racism. And so let me start with some things that we know. And Bruce, you've named some of them, but I'm going to touch on them maybe a little bit differently. We know that Black Americans are twice as likely as white Americans to be hospitalized for asthma. And we know that Black Americans are 3 times as likely as white people to die from asthma. We know this. We know that children living in homes with annual incomes less than $50,000 a year are 1.5 times more likely to fail asthma treatment and therapy than other children. And in those cases, essentially, established treatments for asthma either don't work at all or work much less effectively. So there's a reason that we have zoning laws that forbid automobile exhaust of this kind, that's proposed by the Starbucks drive-through. There's a reason that the city went through all the trouble to establish those zoning laws. And we know how harmful exhaust of this kind is. Bruce, you touched on it some. We know that it literally poisons children and others in their homes and leads to death and chronic lung disease, to name a few. At the recent planning board meeting to talk about this, the developers brought with them supposed experts. I think many of us were there. We heard them talking about how similar proposals and similar structures in other parts of the city have been measured, and carbon monoxide levels were found to be in acceptable ranges. And so therefore this is safe and we should go ahead. And this rationale was accepted by both the city council and the planning board. And I'd like to just point out some issues with this to begin with. The first is that the medical community does not recognize carbon monoxide as the appropriate measure in a circumstance like this. We know that what affects our children and what leads to these horrific outcomes are not from one thing. They're multifactorial, they're complex, and those multiple factors are additive. So this notion that you're going to reduce this down to one thing is a mistaken fallacy from the beginning. So for example, and Bruce, you touched on this some, recent data has focused much more on what's known as fine particulate matter in air pollution than on carbon monoxide or other things of this kind. And just to put this in a context, fine particulate matter are tiny particles that are produced by multiple sources. They're produced by industrial sites, they're produced by gasoline vehicles, both light and heavy duty. And just let me say, light duty gasoline vehicles are cars, cars sitting in a drive-through. And as I say, these are tiny particles. They measure about what's known as 2.5 microns. And to put that in perspective, 1,000 microns make up a millimeter, or 10,000 microns make up a centimeter. So it takes about 25,000 of these to make up an inch. These are smaller than we can see, and they're tiny. Fine particulate matter air pollution is estimated to cause somewhere between 85,000 and 200,000 deaths in the US each year, not to mention the amount of other disease it causes. And Bruce, just as you said, studies have shown over and over again that people of color, Black people, Latinx people, indigenous peoples, are exposed to fine particulate matter air pollution more than white people from every category of source of fine particulate matter, from industrial sources, from light and heavy vehicles. Every source affects people of color more than it does white people, and those sources are additive. So we imagine these cars sitting and producing this next to the playground that you mentioned. And so let's talk for a moment of what this looks like when we think of effects on the people living next door. We've said already the effects of asthma being twice as likely in Black children and Black Americans as white people, and 3 times as likely to die. We've talked already about how poor children are more likely to fail treatment. And I want to just say about what does it mean when in an article someone talks about children failing treatment. What it means for those of us who have seen this, and some of us may have children with asthma, and some of us have taken care of children with asthma, it literally means children who can't breathe, who are gasping and who feel like they're drowning on dry land because their respiratory systems are not working the way they're designed to work. They can't breathe. Now, let's talk a minute about what this means beyond kind of the immediate medical consequences of life and death and illness. And let's use this example of childhood asthma. So, Bruce, as you said in this article, these are children who are in and out of the emergency room, essentially because they can't breathe. So as they're in and out of the emergency room, it essentially means that they're missing days from school. Now, we have a lot of information about what it means to be, quote, chronically absent from school. And we define chronic absenteeism as missing 18 or more days from school a year. So 18 days a year is a day and a half a month. And that's not unusual in a child who is struggling with uncontrolled asthma because they're being poisoned by their environment. So we also know that children who are chronically absent from school are 4 times less likely to be proficient readers by the time they get to 3rd grade. We know that high school students who are chronically absent from school are much less likely to graduate from high school and are much more likely to end up being incarcerated and spending much of their lives in prison. We also know that the parents of these children, and you described it in this article, who are now bringing their child back and forth to the emergency room and home with them when they're sick and struggling to breathe and dealing with the trauma of that, are much less likely to be able to maintain employment and to support their families in obviously important ways. So, you know, we talk a lot these days about systems of racism. We talk about opportunity gaps in this country. We look at data, we look at unemployment rates by race, we look at disparities in high school graduation. We look at this data over and over again, and many people kind of scratch their heads and say, so what can we do about it? And I'm going to say to us all, you know, so here it is. This is how it works. A simple decision like this, or what's seen as a simple decision like this, to change our zoning laws and allow a drive-through next to a housing development. And remember that when they changed the zoning law, they allowed a drive-through next to a housing development, but they didn't allow it next to a single family or a 2-family residence. So there's a lot for us to consider here. So what's the harm that this creates, and how does it now ripple through a family and ripple through a community? And so just in closing now, let me just say that, you know, when we talk about disparities, here's the disparities. Here's the disparity in health from a decision like this. Here's a disparity in life expectancy. Here's a disparity in graduation rates, in incarceration. This is one of the ways for us to look at and understand how racism works in systems and in structures. And as we talk about this notion of racism as ways that advantage some people and disadvantage others and harm others, here it is. Here's the disparity, here's the disadvantage, and here's the harm. Let me pause now and we'll go on. Thanks.
Thanks very much, Dan. You know, we'll take questions regarding Dan's comments and all the others when everybody's had a chance to open up. So our next speaker is Dr. Angela Campbell from the Children's Health and Research Foundation and the Lower Hudson Valley Perinatal Network. Dr. Campbell.
Thank you so much. Can you see my screen?
Yes.
Okay. On. So this is very important work for us as well. New Rochelle is one of our areas that we cover, and we know that we've been getting questions about just quality of air and life expectancy in New Rochelle as well, even before this happened. So we start with knowing that we have to define environmental justice, and we know what that is, and we want to make sure that the families that we serve also are put into the conversation or thought about. So we want to think about policies and processes that are going to make sure that the risk of birth defects is decreased, that we are addressing low birth weight and prematurity and miscarriage. And these are all things that are led by having air quality that is not comparable to a developing baby. So in New Rochelle, we cover 01 and 05. And so, as you know, the proposed area is supposed to be 10801. So this will be in line with what we're doing as well. So we know that in New Rochelle, the premature birth weights averages 12.4. That's 8.8% higher than the county rate of 11.4. And we know that low birth weight, the average is 9.1, but in the areas that we're referring to, it's 15.2% higher than the county-wide rate of 7.9. Infant mortality in this area The average is 4.9. It's 36.1% higher than the county-wide rate of 3.6. And we also know that we are looking at the poverty rate, which is 8.4, and New Rochelle is 10.7 as well. So what is toxic for the perinatal individuals? So we know that we're looking at the environment in which these women and these families and these individuals are having and taking care of their families. So we knew that during every stage, environmental factors do affect the development of the fetus. So we want to make sure we understand what the exposure levels are. And if we don't know what they are, then we don't know how to protect the mom correctly. Any form of perinatal stress felt by the mother can have negative effects and impact on the fetus development. So we know that there are individuals in New Rochelle who are questioning these things, and that puts stress on these pregnant moms. We were talking to a pregnant mom recently, and she was asking about it because she had heard that there was a meeting, and she was very stressed talking to us about it. So we said we would get more information and talk to her. So we know that since 1973, they have known that there's a link between the exposure that a baby has to air pollution, and then there will be low birth weight activities that occur. So the air pollution outside can cause problems by increased premature birth, that's less than 37 weeks of pregnancy, low birth weight, less than 5 pounds, stillbirths, and babies breathing properly, and learning skills, as Dr. Miller had said. So we want to make sure that we understand that what we expose this baby to, and we're not just talking about carbon monoxide and carbon dioxide, as we said before, we're talking about just a whole host of environmental pollutants that we need to address. So what is the link of the perinatal woman and air quality? We know that premature births and low birth weight is linked to numerous health problems later in the life, as we talked about with education in school, missing days if there's asthma affiliated with. Black women are still 3 times more likely to die during childbirth. So we know that's in New York State. So New York State is almost 30 to 40, depending upon what year we're looking at, because in New York City, it's 12 times more likely to die. But in Westchester, it's 3. Black women are more likely to have life-threatening morbidities during birth as well. So we want to make sure that we look at the studies that were done, and Johns Hopkins did one that we looked at air pollution levels below the EPA standards, and still found that air pollution appears to have a biological effect at the cellular level in the pregnant woman. So we know that being exposed to small amounts, and we talked about that, the size of these particles are small, and that's what makes them dangerous. If they were larger, then they could be seen and they could be maybe avoided. But we know when they're small and you need a microscope to see them, we know that that's one of the issues when we're dealing with something this size. So we know there was a study done with 5,000 low-income moms, and 2/3 of them in the study were exposed to air pollution. And we found that even in this controlled study, that when we were able to find out who got exposed and by how much, the lowest levels of exposure still had inflammation of the uterus. And the first trimester appears to be the highest risk. We know a lot of women don't even know they're pregnant during the first trimester. So we want to make sure that women are always, even when it's interconception or preconception, we want to make sure that women are, and men and families are kept at low risk. So when we look at the air quality index, the pollutant standards that they use, we look at a 24-hour duration. So I'm not sure what the city did, but we want to make sure we're not looking at small exposure times like 8 hours when someone works. People are living there 24 hours a day, 365 days a year. So we want to look at the health effects of the fine particles over that period of time. The potential damage is caused by the air pollution because of the concentration of the exposure, but also by the duration. So if we're talking about that longer period of time. And as we said, we're talking about 2.3 micrograms in size for these exposures. So some of the questions that we're receiving is, do my lungs filter out dirt and the placenta filters out bad stuff? That was one of the questions. What type of particles are dangerous? And what does this PM 2.5 cause? How does it cause the most serious health problems. And we know that the lungs and the placenta can filter out anything greater than 10 micrometers. So motor vehicles produce fine particles at less than 2.5 micrometers. So we know there's a problem there. And we know those small and light particles are attracted to water molecules. So they stay in the air for long periods of time. And they bypass the nose and the throat, and they penetrate into the deepest part of the lungs and circulatory system. So that would be also dangerous for our moms as well, and their developing fetuses. So we know, as we were told, the human hair is about 70 micrometers, and we're talking about something that's very much smaller, 30% smaller than that. And we know that with all of the studies for air pollution, we know that there's an 8% increase for all lung cancer and mortalities for that population as well. So exposure to this size particle can trigger the cardiovascular diseases and mortalities and non-fatal events. We know that. But we also want to look at children and those suffering from lung and health diseases. They're especially susceptible to the effects of these fine particles in the air. So we know that Occupational Health and Safety Administration has the 1910.134 that addresses respiratory protection when you are exposed to particles of that size. We don't have anything for our own families and communities, but we know that we want to look at the standards, and the standards are very clear. When you don't have an HVAC system or it's not functioning properly, then you need to place that building under negative pressure. And this is work environments, and you're there 8 hours a day. Also, they're looking at putting respirators on people that are exposed to that size particulate. And you must look at the temperature, the humidity and airflow, because these particles are attracted to air molecules. So these are all the things that OSHA is looking at. And these are some of the issues that we might want to address. So at MISH, this is our team. And these are some of the babies that we've been taking care of and moms during the last few years. And there are other things that we're struggling with. But this one in particular was a COVID-9 baby. And so she's in New Rochelle. She's connected to, a whole host of just good support systems. But we know that we have community health workers that come in, and we are the frontline workers. So we hear about the stories. Our community health workers come in to the home, and they help a mom through the pregnancy and then also postpartum. This is another family where they were dealing with mental health issues. So we know that when we're talking about putting stress on these moms, we have to look and see how they're doing, what their concerns are. And when it comes to what's going on with this location, with the air, there's a lot of concern and emotional energy that's being asked for us to understand, for us to help these moms and to figure out in these families what to do. And there's been a lot of questions about their children, their school-age children as well. So we know that we're going to stay engaged, and we're going to be a part of any civic engagement opportunities that we have when it comes to New Roar, and just be very proactive here. Okay. Thank you so much.
Thank you very much, Dr. Campbell. And that's really a deep examination of an area that sometimes we don't really think as much about as we need to. So our pregnant women and our fetuses and our babies need to be taken seriously when it comes to the effects of pollution. Our next speaker is going to be Dr. Marianne Mackman, who's going to address the effect of environmental pollution and the environment in general on mental health.
Yes, mental health is somehow underrated. Mental illness and anxiety and depression and PTSD and substance abuse and whatever are the cause of enormous reduced productivity in the United States. Our city is a microcosm of the country in experiencing, I would say, 4 current major public health disasters. The one is pollution, which my colleagues have so wonderfully been talking about. Then there is COVID pandemic, And climate change and gun violence. Climate change and gun violence have to be left for another time. But and most of what I meant to say about pollution has been said by the others, except I would say that there are tremendous mental health stresses in living in a polluted environment. Constant stress of living in a polluted environment, depression, anxiety, and even reduced cognitive function. There was a little blurb in the Times today that was talking about the reduction in cognitive function in people that work in offices. And these are not people who live in deprived communities. So it is a major problem. So I would just simply move on. Lead poisoning was not mentioned by anybody, and that certainly affects fetal development and cognitive development in children. And there was even a report of lead-tainted water in Davis School in 2016. But the COVID epidemic is really what I would address. And we were, after all, an early epicenter. It's been a total mental health disaster for so many people. And since the onset of the pandemic, the National Institute of Mental Health has reported a doubling of pre-pandemic rates of anxiety and depression and stress-related symptoms, PTSD, for example, and substance abuse and suicidal thoughts. The Black and the Latino communities have experienced both the highest rates of job loss and the greatest number of essential workers exposed to the virus and all the stresses that go with it. In many communities, there have been profound financial concerns, food insecurity, deaths from COVID, difficulties managing children out of school. Children have had increases in anxiety due to the loss of most of the stabilizing factors in their lives. 3 out of 10 adults have been troubled enough to seek therapeutic assistance. Many people have suffered prolonged mourning following deaths and slowed down ability to function. One study said 6 out of 10 people in one study demonstrated significant fear of COVID itself with negative impacts on their mental health. In addition to psychological problems, some people have shown direct brain manifestations of COVID, even psychosis. People with and without the virus have, through stress, experienced cognitive problems and difficulty concentrating. It's a disaster. And we are very much involved, as particularly our less fortunate communities. Though there's been an increase in the availability of hotlines, in-person or virtual mental health care has been insufficiently available. Some people are reluctant to admit emotional difficulties and therefore don't seek help, even though they're very distressed. Psychotherapists in some areas are quitting their jobs because they find the distress of their COVID-related patients too much to bear, and that certainly is troubling. So to close, I mean, there's a lot more to say, which I will not. But to close, I have 2 little bits of really good news. One is that Westchester County is instituting, I hope soon, a new system of mental health crisis response. If there's a mental health crisis in the community, New Rochelle, the police will not be called, but there will be a special number to call a crisis team to come instead of the police. And that's an enormous step forward. And the other is that the psychiatric community finally has become aware of structural racism in its own organization and in psychiatry at large, has instituted vigorous efforts to make meaningful change, anti-racism education, a call to recruit more Black students into medicine and psychiatry and into leadership positions, and that will at least aid the environment of mental health care. Thank you.
And thank you, Dr. Mackman and all of our speakers. So we will now invite those of you who've been listening to us to get involved in the conversation. The best way to do this is to enter your questions into the Q&A section at the bottom of your screen. Dr. Itzkowitz will go through those questions and present them to our panelists. So please feel free now to put your questions in and let us know your responses, your reactions, or areas where you're interested in receiving some more information.
Maybe while we're waiting for people to enter queues, questions, not answers, but questions. I think it's worth looking at the perspective that we learned from the COVID pandemic. I think one of the things that the COVID pandemic actually was good about telling us was what happens when you clean the air. You know, it's really hard to measure the effects of air pollution, but what happens when there's no air pollution? So during the COVID pandemic, the air across the world really improved. And the research suggests that air pollution, although it accounts for 5 million deaths per year, during the COVID pandemic, the height of the pandemic in April of 2020, it's estimated that 11,000 lives were saved, basically. 11,000 fewer people died because of cleaner air. And over a 2-month period at that time in China, about 77,000 lives were saved, if you will. So we can't do that experiment. We can't just clean the air and see how people's health gets better. But what we can do is try to prevent the air from getting dirtier. And so if you have an opportunity to not contribute to air pollution, why not take that? You know, I think we're all looking for sort of scientific evidence that one thing and one thing only causes the outcome that we're interested in. And as Dan and others really so eloquently put, it's not one thing. And it's certainly not carbon monoxide alone. It's particulate matter, which is difficult to measure, but which we know causes all this harm.
You know, Steve, if I might, you know, I think you're making a really important point here. And, you know, it makes me think in NUROR recently, we've been talking about ways of knowing and how we know and what we know and the different ways we know. And, you know, what you're raising, and I think what others have raised, makes me think back to kind of the history of the tobacco industry and smoking. And we knew for decades that people who smoke die earlier, develop lung cancers, heart disease, all the things we know. And the industry spent a very long time trying to say, we haven't scientifically explained what it is that causes these things, so maybe it's not smoking. And, you know, as you're saying, we don't need yet to know what are the exact mechanisms of harm. We know that there's harm, and we know what the harm's related to and what causes it. And I think the rest of that science will come, but there's no reason and there's no way we should be waiting for it to protect our children and our neighbors and our community. You know, and so I think, you know, the history is that these arguments of what's the one mechanism are generally used to try to support and defend something that we know is dangerous. And it's just what's happening here and now. We know this is dangerous. We know, and if it wasn't dangerous, we'd have drive-throughs next to every residential home and next to everyone, and not just allowed next to a municipal housing building. And this is about who is valued in our community and who is not. And this is racism.
You know, I just, as the only non-physician on the panel here, not that I'm on the panel, but I just want to say that it was astonishing to me that we do not use common sense to say when something is wrong. I mean, the epiphany came when I was stopped at the light at Echo and Huguenot, and it's like, how is it even possible that this is going to be allowed? And I think that what is in plain sight becomes obscure because, well, it's always that way, you know, or they didn't complain, you know, that's what you'll hear. No one complained, you know, and that's not the right answer. You can't smoke in a restaurant or even outside anymore on a restaurant because we know it's bad and we won't take the chance, but we'll take a chance on 100 kids and 300 people who are low income working class people. And the other thing I want to say is that the Hudson River, when I was a kid, was on fire. Everything that was flammable was in the waterway, and it took a lot of people to say enough is enough and to stop. And now you can kayak and fish in the Hudson. So this is not a fanciful thing to say that we don't need drive-throughs abutting residential apartment buildings, but we don't need drive-throughs, period. We need to act as if there is a climate emergency, because there is a climate emergency. For those of you who had been part of the training on the EPA EJ screens, they have maps of 100 years. What will New Rochelle look like? I live in a house that's 100 years old. My house would be waterfront in 100 years. What in the world? What in the world? Anyway, thank you.
We do have some questions. One question is, Montefiore is an anchor institution in New Rochelle. Are they absent from the conversation? And what is the best way to invite their participation in supporting our community? Any comments from the panelists?
Well, I know that Montefiore is getting involved in the New York State's birth equity platforms. So that'll be a way for, I think, them to come into the conversation, and very soon. And there are community liaisons that reach out to us and say, what does New Rochelle need? They're not from New Rochelle, but they want to know what the needs are for New Rochelle. And that's from Montefiore. So I think that they should be invited and come, and then bring that back to their teams and talk to the other partners that they have.
I'll add that as somebody who worked for many years with Montefiore, Montefiore has a long and really storied history of involvement in community health and public health, primarily in the Bronx. I worked for the Department of Family and Social Medicine. Social medicine was a field that was largely developed at Montefiore over the last 50 years. Montefiore has changed a lot. Healthcare has changed a lot. And I will say that Montefiore's arrival in New Rochelle is a rather recent arrival, and I think its role in New Rochelle has not kept up with the standards it set for itself in its many years of providing attention to social medicine in the Bronx. So, Montefiore has departments of community relations and outreach, and I really think we in New Roar and others need to step up our game in terms of holding Montefiore accountable for the large role that it does play in our community, and really demanding that it address the public health of New Rochelle as it's addressed the public health of the Bronx over the decades.
Another question, you all have so much expertise and knowledge about these issues of environmental justice and structural racism. And just to name a few that you've spoken to: asthma rates, perinatal statistics, mental health. Does the city council or planning board come to you to ask you questions about, for example, the issue of a drive-through Starbucks, so that they can be better informed?
I want to offer that I think it's a beautiful
Yeah.
rhetorical question that whose answer I think we all know. And I think, I think the vision of an environmental racism tour, the vision of a panel like this and the others that have gone on is just to that point of raising awareness in our community, so that our representatives represent us. So it's a great question. Thank you.
And I would add to that if you watch the city council in action, you can see that they have a particular way of doing business. Their default position is to encourage development in New Rochelle. They have not historically been very critical about where and how that development takes place. Influential communities have influence, and communities without much influence end up kind of holding the other end of the stick. I think this is what structural racism is all about. These are the traditions and the norms and the culture and the patterns that have been developed over years of constantly putting sources of pollution in poor minority communities. And it will not end, despite all the pretty words that can be said by the mayor and others on the city council. It will not end until the community forces it to end. And I think, this is, to echo what Dan said, this is hopefully the start of a process, including the tour this weekend, that will really put this on the agenda and make it impossible for the city council to just do business as usual.
Another comment, Montefurious can't be considered a real partner since they are actively reducing our access to healthcare. How do we get our full functioning hospital back, not a teaching hospital? I might comment on that. I'm not so sure that the problem is that it's a teaching hospital. I feel that teaching hospitals serve a purpose. I work at one, and I think teaching hospitals are very important for every community. But I do agree that more engagement of the hospital system in our local community, or at least in the conversations, would be helpful. Other comments?
Steve, if I can just add to that, I think it's an important point about Montefiore, and I think there's a lot of good experience that one of the things that really helps a community be healthier or access healthcare is not just a hospital system, but access to really good primary care that is often not connected to hospitals. And being in the community health center movement, this is the mission of the community health center movement. It's what we do. I will share the community health center I work with is in the midst of trying to bring a federally qualified health center to New Rochelle with access to really good primary care. I can't say if and when it will happen, but it's those talks have been going on for a while. So I think that combination of solid primary care that's accessible to people and is really interested in working with a community and with people is a crucial part of this.
If I might, so Lower Hudson Valley Perinatal Network did a community assessment in the summer. And there was some themes that really were interesting to us. One of them was that residents felt that they didn't really know what the activities in New Rochelle were, that they didn't know, and one resident suggested maybe a robocall or something where they could get access to knowing what is going on in the city. They felt that they lived here, they felt there was a lot going on, but they felt kind of disconnected to how to access the information about New Roar and others. So, and they said those who had children felt they got information through the book bag and when school went back to in session. But others felt that as community members, and some of these women were pregnant, they didn't feel connected and knowing what was going on, when it was happening. They kind of felt like if they saw a flyer, and a lot of them don't have fancy phones, they said, so they need like WhatsApp or something very simple to get this information, but they just felt very disconnected and uninformed about so that's something that maybe we could work on, because that was one of the major themes that we heard when we did the assessment at Bracy Houses. Mm-hmm.
Thank you, Dr. Campbell. Any other comments, either from the attendees or the panelists? Otherwise, we'll turn it back over to Lisa, our fearless leader, who can wrap it up.
There's
Please feel free to.
More questions in the Q&A, Steve.
Oh, sorry, I didn't scroll down. So do you have specific suggestions as to what you can do to hold our elected and appointed officials truly accountable and get them to really hear us?
Yes, elect others.
And another comment question, in listening to the presentations about the cyclic nature of insidious childhood asthma, prenatal dangers, low birth weights, mental health issues, I'm wondering, in allowing the zoning change to allow Starbucks, was there anything mentioned at the city council meetings as to the incredibly alarming traffic conditions outside the Main Street apartments, the nearby Taco Bell drive-through? Doesn't this create a multiple, almost triangulated scenario of exposure to the particulates mentioned?
Yes, it was mentioned. Yes, it was noted. Yes, it is a series of special permits allowing various commercial enterprises that have no business so close to residents going back to 2006. And yes, it was unanimously voted in favor of. So we clearly have a problem. We clearly have a problem in New Rochelle, and that's why we're here. And that's why we're here, because most of us do not spend a whole lot of time reading the agenda for our public planning boards. We don't read the agendas even for our city council. We don't have the Standard Star anymore so that you can read it daily, what's going on. So the burden of democracy is a well-informed citizenry. The burden of people of goodwill is to be mindful, and when they see something, to say something and tell their neighbors. So we see something and we're telling our neighbors, and we need everybody's help. And you need to, and the questions that question that you ask about what was city council looking for and why aren't they listening to the doctors in their community? You know, I mean, it's, you know, listen to me, I'm, you know, I don't have a degree, I understand that. But when you have professionals coming and asking and telling you something and you still don't listen, then that is on us as residents and voters in the city to really reassess our relationship with those who seek to represent us, and to make our voices heard. So I thought they might be visual learners, and so that's why we're having a trolley tour. But you have letters, you have your voices, and everyone has a council person. This is not just a District 3 problem. This is a city problem. So I think that's where we're going to end it, because we had said it was going to be no more than an hour, and we're approaching that pretty quickly. So I thank everyone for being on this panel. My friends, you guys are wonderful. We will make this recording available probably on YouTube. I hope everyone has that. Angela, we got a number of people who are interested in your slide deck, and we will definitely make that available through email. Please, we're having another listening learning session tomorrow at 6, talking about the hidden history of Pugsley Hollow and why Bracy Apartments is called the Hollow. So look for a Zoom invite to that as well. And we will keep you posted. But thank you, everyone. Remember, citizens who are truly engaged are the ones who make the changes. So thank you all.
Thank you, Lisa, for doing this all. Thank you, thank you, thank you.
And thank you, New Roar. So
Thank you for having me. Yeah.
Thank you
Okay.
all.
Thank you,
Thank you.
Lisa.
Thank you,
right.
everyone.
good night, everyone.
Good night.